name is Caleb Whitfield, and I'm currently a first year MPH student here at Morehouse School of Medicine. And this is the third episode of Conversations with MSM Legends. How are you doing today?
I'm doing well. Pleasure to meet you, Mr. Whitfield. Thank you for
Yes,
having me.
sir. Yes, sir. Thank you for taking the time out of your day to interview with me. Now, the first question I want to ask you is, what brought you to Morehouse School of Medicine? Why an MPH?
Wow. Um, it's been a while. So I initially my thoughts were I was going to go to become a bench scientist, and I
Okay.
was on track to get to do some doctoral training in immunology. And in the midst of that, although I appreciated being a bench scientist and the discipline that it requires to do that kind of work, I found it a little bit too isolating from sort of, I won't say reality, but it was somewhat disconnected from the day-to-day social political events that impact health outcomes and well-being among African Americans or people of color. So I needed to think of a way to sort of transition that science background, knowing that I still wanted to do science, but I wanted to be a little bit more engaged in the public health degree. I decided to go public health instead of going straight to a PhD program, and focus there on international health and epidemiology.
So you mentioned a PhD. So I also saw in your biography that you have a JD as well. So could you talk about your reasoning for getting a PhD and a JD and how that benefits you in your career now?
Uh, well, actually, I got interested in it while I was an epi, entry level or junior level epi at Georgia Department of Health around the time of the Master Settlement Agreement, the Tobacco Master Settlement Agreement. And that gave me the opportunity. I was fortunate enough, at least in hindsight, to sort of lay out the first installation of the dollars that Georgia received, about $20 million. So doing that work, before we got to that point, there were a lot of meetings and interactions with the National Association of Attorney Generals. And in that space, I got an opportunity to see sort of um, the epidemiological or public health perspective, and then sort of the legal perspective. From there, I went to University of Michigan and took some coursework in epi and the law, and it was a seminar with 4 or 5 lawyers and 4 or 5 epidemiologists, and they're sort of talking about how much there was an overlap between the two disciplines. And from that moment on, I was convinced to do the PhD JD. And from there, I focused in forensic epidemiology.
Okay. So for someone like myself who is just embarking on this journey of public health, especially during this time of um, public health professionals really being emphasized, um, in your opinion, how important is policy during this time, and just as in general in the public health arena?
I would say it's extremely important, critical. Um, I'm often on conference calls and with individuals, and there's always a underlying or a sort of specific commentary or conversations about um, is leading with science and leading with data to shape policy. But often what happens is that um, the science can get lost in the politics, or the science is refracted to the politics versus the politics being refracted to the science. And so when that happens, it does have a direct impact on policy, uh, whether it's short-term policy, meaning how to stand up a vaccination center, how to stand up testing sites. And we don't lead with the science, which we've seen on a national level. And then also, arguably, we've seen it as a population on state and local levels. So the policies sometimes are not as robust and not as effective as they could be.
Understood.
So it's critical. It's critical. And you got to think about policies, not just legislative policies, but sometimes
Right.
policies and practices as well.
Right. Now, I do want to ask this, and I feel like this is very important considering um, your history at Morehouse School of Medicine. Like I said before, I'm embarking on this journey, and Morehouse School of Medicine really emphasizing um, giving back to the community, making sure and serving underrepresented populations. Um, as a Black man, what does that mean to you?
Mm, many things, but I think how it lands, at least initially, is being at the table to have to engage in the conversations and shape the direction of those conversations. And sometimes when I say shape the direction, that can involve being persuasive in terms of sort of you know, oppositional points of view, but it's also shaping the conversation because there's often a lot of misunderstanding about the Black narrative and what that means, from the policy or the procedures to how it lands actually on the ground. And if we're not at the table to sort of guide those conversations or bring up things that other people wouldn't think about, um, then those policies and practice often do um, a level of disservice to the people that they're intended to help.
And why is this so important? Why is this so important? And where do you see this going 10, 20, 30 years from now?
When you say why is this so important, what do you mean exactly?
Why is it important to have people of color at the table making decisions?
Well, I'm gonna I'm looking through the lens of health and health outcomes, but ostensibly you could apply it to other areas too, education, employment.
Of course.
Because in order to move the needle on the larger populations, you're going to have to move the needle on those populations who are um, disenfranchised, uh, who are marginalized, disconnected, and sometimes, unfortunately, being dismissed, right? So you can't get at health equity without getting at those populations and getting at them overtly, not covertly or subtly. Or you can't move the needle on health outcomes. You can't move the needle on economic employment. You can't move the needle on education unless you move the needle on those individuals. So yeah, yeah, to say the least.
Well said, Dr. Franklin. And where do you see, per se, public health moving in the next maybe 10 or 20 years, especially after this pandemic? And I know it's a loaded question, but the pandemic really showing how people of color, Black and brown people are really at a disadvantage when it comes to certain health disparities and in health issues. So now that people have a understanding of that, and unfortunately, it took COVID-19 to kind of display a lot of that. So now that that's been on the table, where do you see public health going 10, 20 years from now?
Well, hopefully, one of the sort of um, positive that can come out of this pandemic is that I believe people have a better understanding of what public health is, um, what what it means to have an infrastructure to support the activities of public health, and that you cannot sort of under resource that infrastructure, and you can't bear the benefits without bearing the burden, right? So I think people have got this aha moment now, like, oh, I get it, I get it. And I hope, and I think it's up to the public health community, those who practice research and who are involved, take the opportunity to seize this moment to ensure that public health can recover from the years of being under resourced, and making sure that it needs to be a part of not just those who are in the gap or those sort of safety net populations, but public health has to be at the table in many other areas. And I'm hoping that we take that opportunity and that we sometimes don't always have to wait to be invited. Um, the question should become, why shouldn't we be invited? Not why should we be invited? So I see public health getting stronger. I see the practice is going to open up to probably a multitude or broader set of people who can bring so many things to the discipline that would probably never thought about being public health, right? Whether it's engineers, more tech people, or things that you don't normally, people who we don't normally see as being in public health, we don't normally consider, and they probably don't normally consider us, right? So I'm hoping that it will advance public health in many ways, not just funding of monetary dollars, but funding of more bright minds.
Well said, Dr. Franklin. Well said. We're actually getting a little close to the end of the interview here. Just quickly, what does Black History Month mean to you?
Wow, I gotta see who came up with these questions. That's a big one. I think particularly in given these times and some of the tumultuous events that have occurred in the last year, I think for me in this year in particular, it has created this space to be unapologetically Black and not sort of whispering Black or whispering it and in the shadow, right? So I think this year is sort of like it's Black with a capital BLACK, and
Yes.
yeah, and people will have to adjust.
Yes.
Yeah.
So, Dr. Franklin, thank you so much for taking the time out of your day to educate us, give us words of wisdom.
Absolutely. It's been my pleasure.
Exactly, on, just your journey, your experience and what health equity means to the country. I want to thank the alumni and the supporters for investing in students like myself. I'm a first year MPH student, but we have other programs at MSM that that will benefit from this. So don't forget to support us by texting MSM Legend to 41444. And Dr. Franklin, thank you again. I hope that you have a good evening and enjoy the rest of your day.
Good luck in your program. All right.
Thank you.